All right. Well, we will let people continue to trickle in, but we will go ahead and get started. Welcome to this month's Understanding ADHD speaker series, hosted by the ADHD Empowerment Meetup Community and the nonprofit Children and Adults with ADHD, or CHAD for short, of San Fernando Valley, Los Angeles. I'm Suzanne Sophos, our executive director. I'm also an adult with ADHD and mom to a third grader with ADHD. CHAD has been hosting this speaker series for the last 5 years, bringing experts on the topic of ADHD directly to the community. This event is just a part of our work to educate, support, and advocate for adults and children living with ADHD. We also host online peer support groups for adults with ADHD, young women with ADHD, and parents of ADHD children. Our women and adult groups are on Sunday evenings, and our parent group for parents of ADHD children are the first Fridays of every month. All of our groups are facilitated by our dedicated volunteers, and all of our work is funded by donations. Because we want to ensure that everyone who needs ADHD education and support can receive it, there's never a fee to attend our events. However, we are a nonprofit, and our survival depends on donations and membership fees. So we kindly ask that if you're able and you find our work worthwhile, you consider making a $5 or $10 donation tonight to help support our work. One of our volunteers will post the link in the chat. I'd like to share a few quick guidelines just to help you get the most out of the meeting tonight. For your own privacy, you can set your name to your first name and your location, leaving out your last name if that makes you more comfortable for your privacy. You can also keep your audio muted when you're not speaking, something we're all familiar with, having used Zoom for the last few years. And then during this meeting, you can use the chat feature at any time. You can use it anytime you have a question, and the moderator will keep track of your questions for our Q&A at the end. You can ask questions to clarify, and those of us that are helping moderate the meeting will help answer your questions, or just to share thoughts. It's a great way to connect with other people during the presentation. And then we will have a Q&A portion of the evening at the end. And if you can hold your questions until then or keep them in the chat, that would be great. And we will go through those at the end. As everybody types them in the chat, I will moderate them and give those to Stacy. So before we dive in, we like to start with a little bit of an evidence-based overview of what ADHD is and how it impacts individuals. That way we're all on the same page. ADHD is a lifelong neurobiological disorder. It impacts brain function in a way that impairs executive function, delays social emotional development, and impairs our self-regulation. So rather than thinking of individuals with ADHD as simply having too much energy, which some people call hyper, or too little energy, which some people call inattentive, or worse, lazy, a hallmark of ADHD is actually impaired self-regulation. So that means trouble getting our bodies and our minds in the right frame for the task at hand. So sometimes we might have too much energy, more than the situation calls for. This is a hyperactive state. Maybe we get too focused on a project and forget to walk away to eat or use the bathroom for hours, also known as hyperfocus. Maybe we get excited about a new idea and ramble on to a friend without realizing we didn't let them speak. At other times, our bodies and our minds regulate with less energy or attention than a situation calls for. And this is an inattentive state. Maybe we zone out while we're taking a test or having a conversation with someone on a topic that doesn't quite keep our interest. This can also show up as trouble getting started in the mornings or getting motivated and organized to do something challenging like paying bills. Individuals with ADHD can veer toward hyperactive or inattentive, or be a mix of the two. For people with ADHD, getting our bodies and our minds to cooperate and serve up just the right amount of attention and focus for the task at hand can be extremely challenging. Studies show that if ADHD is not diagnosed and well treated, ADHD-related challenges can significantly decrease life expectancy by up to 13 years. That's hard to hear, but important to know and understand. The good news is that studies also show that life expectancy and outcomes are dramatically improved by two things: a proper diagnosis and a lifelong holistic treatment plan. A holistic treatment plan includes a combination of ADHD education, skills training, medical treatment, and peer support. Understanding ADHD also means understanding the brain's executive functions, because those are both delayed and impaired in individuals with an ADHD diagnosis. These functions are what help individuals manage and regulate our planning, decision-making, learning, judgment, emotions, and actions. Pretty much everything we do in our lives on a daily basis is impacted by our executive functions. And there are several that you'll see here. This particular model, and there are several models, if you look on the internet for executive function outline or whatever, you will find a couple different models. This particular one is based upon Dr. Thomas E. Brown's model of executive function, and you'll see that he classifies them as activation, focus, effort, emotions, memory, and action. And basically anything that we do, say we're about to start on a project, that project might take a combination of activation to get started, focus and effort to keep going on it. Depending on how long we put it off or how we're feeling about our ability to do it, emotions might also come into play. So as you can see, this particular area of ADHD is a challenge that impacts so many different areas of our life. Something to know about executive function skills is that they can be strengthened or developed. You can think of them like a muscle. So often with medication or other treatments, receiving executive function coaching to learn how to strengthen those skills can be a really strong way to support the executive function challenges that ADHD brings. And these slides are up on our meetup and also in our Facebook group, which I'll post in the chat shortly. Tonight, we are so pleased to welcome Dr. Stacy Reger. Dr. Reger is a clinical psychologist practicing in Southern California who specializes in aging. She will discuss how ADHD challenges change and often intensify as women approach menopause, and discuss the current science behind menopause and ADHD, as well as practical ways to manage ADHD symptom, the way that ADHD symptom changes accompany aging and menopause. We are so happy to welcome you. I'm going to stop sharing my screen now and turn my video back on. There we go. Hi, Dr. Reger.
Hi, thank you so much. I'm really excited to be here and to talk with the group about this. So I have slides that I'll share and go through, but I can say a little bit about my background just to kind of give you all an idea. So I do specialize in aging. I'm a geropsychologist, and I have spent a lot of my time clinically working with cognition in one form or another. So I do cognitive assessments, I do neuropsych testing. I've done a lot of cognitive rehabilitation work with folks who are recovering from like strokes, traumatic brain injuries, that kind of stuff. And I also have done quite a bit of work with, you know, mood and just sort of the grief, you know, the various things that kind of come with aging. And I have found in my work that there are a fair amount of older adults who have probably always had ADHD and have never had any kind of diagnosis. They've never, you know, I think that, you know, generationally, it just wasn't something that was really ever tested for or diagnosed. You know, those were the kids who just were, you know, sort of dubbed as class clowns, misbehaviors, dropped out of school early, those kinds of things. So, you know, I was saying to Suzanne when we were speaking briefly before the presentation about, you know, that it can be such a life-changing diagnosis. And I think if you're not in it, it can seem like, oh, it's a bad thing to get a diagnosis, you know, of something related to mental health. But when you have all of these symptoms, you know, that really don't make any sense, but they make your life so much harder, it actually can be such a relief to get that diagnosis. And I have found that to be true working with older adults. And then, you know, then I do a lot of practical, again, cognitive rehabilitation type work with older adults with ADHD, or who are starting to have memory problems and want to kind of shore up their memory, or have both. And so that's kind of my background and my interest in this work. You know, I think there's not enough support for aging in general, and certainly aging with ADHD is one of those things that just I don't see a lot about it out there. So I'm really happy to talk to you all about this and answer any questions that I can, and hopefully offer some practical strategies. So without further ado, I will go ahead and share my screen. And all right, can you guys see what looks like a PowerPoint presentation? Yeah, I'll assume that silence means we're good to go unless you guys speak up and tell me. Okay.
You're good.
Great, thank you. Okay. All right, so this is just our kind of roadmap for tonight. I did an introduction. We'll talk a little bit about ADHD, although Suzanne did a very lovely summary, so we won't spend a ton of time on that. And we'll talk about hormones, menopause and cognition generally. And then we'll talk, hopefully the meat and potatoes will be kind of strategies for how do you manage this if you or someone you know is dealing with menopause and ADHD. And then I have a couple of recommendations for books that I like, podcasts that I like for this area and this work, and we can open it up for questions. Okay. And again, if you have a question and you want to just drop it in the chat, that's totally fine. We can, I think Suzanne will keep track of those and we'll get to all the questions. Okay, so let's first start with the basics. What is ADHD? It's a neurodevelopmental disorder. It impacts children and adults. And symptoms include a pattern of inattention, hyperactivity, and impulsivity that interfere with functioning in various domains. So school, work, interpersonal functioning. ADHD is estimated to affect about 8% of children and between 4 and 5% of adults in the US. So about half of the children with ADHD continue to have symptoms into adulthood. It's a very brief summary of the diagnostic criteria and how we as psychologists might go about, trying to tease apart whether somebody's symptoms are an ADHD. But essentially, as Suzanne mentioned, ADHD is essentially a problem of executive function. So, so that's the DSM-5. So executive function is essentially everything that the front part of your brain does. The frontal lobes, prefrontal cortex. They do a lot of different things, and all of the symptoms that come with ADHD, inattention, hyperactivity, poor impulse control, those things all are kind of controlled by that same part of your brain. So the risk factors for ADHD honestly are not very well understood, but we do know that there is a genetic link. It often runs in families. There's a gene variant that increases the activity of dopamine transporters that is under a lot of study right now. And basically what that means is that when dopamine transporters are overactive, they're sort of the cleanup crew for dopamine in your brain. So they go through and they clean up the dopamine too quickly so you don't get the full effects in your brain. So other risk factors, low birth weight, premature delivery, alcohol, tobacco, and drug use during pregnancy, exposures to toxins like lead during childhood, and brain injury. So that's where, I see a lot of folks with ADHD because I don't work with kids, but I work a lot with brain injury and strokes, and people can kind of develop ADHD symptoms as a result of those sorts of things. So the frontal lobes of the brain essentially kind of manage the rest of the brain. I like to say that executive functioning is like anything an executive or a CEO might do in a company. So planning, organizing, initiating, impulse control, problem solving, flexible thinking. And ADHD is really a problem of executive function. So I think I mentioned, so part of what's going on with ADHD is that there's a problem with low dopamine activity. And dopamine is a neurotransmitter that's made by the body and used in the nervous system, so your brain mostly, to send messages between nerve cells. Dopamine is responsible. You might have heard about it in the context of like drug use, substance use, that, you know, people get a hit of dopamine. So dopamine is responsible for allowing us to experience pleasure, satisfaction, and motivation. And dopamine also plays a role in movement and attention. So stimulant medications like Adderall and Ritalin actually increase dopamine levels in the brain. So that's their mechanism of action. That's how they work. Other studies have shown that, you know, some other brain structures probably also play a role in ADHD. You know, it's all connected. It's no one part of our brain is fully responsible for any one function, generally speaking. You know, there's a lot of overlap and different areas of the brain that contribute. But we know that the motor cortex tends to be overactive in kids and teenagers with ADHD. And the cortex of the brain appears thinner in the areas of the brain responsible for attention control. So it kind of makes sense, right? These parts of the brain that are involved, they are related to attention, to disinhibition, meaning impulse control and hyperactivity. So actually in most kids, these brain differences that are, you know, apparent during childhood actually normalize by late adolescence. So that's why we see this, you know, about half of the kids who are diagnosed with ADHD, their symptoms go away by the time they reach adulthood. I want to talk a little bit specifically about girls because, you know, if you're on this call, you may be somebody who was a girl with ADHD, and most likely you didn't ever get a diagnosis. It's actually a lot more common that boys get diagnosed than girls. So there was a really big study that was done following a group of girls, a cohort of girls with ADHD, and that study found that after a decade of following these girls, about a third of them after 10 years still met criteria for ADHD. Another third met partial criteria, so still struggling with some symptoms of ADHD. And then a third, you know, had reported that their symptoms were totally resolved. So, you know, it seems like, you know, these symptoms are sticking with girls over time. And we know that ADHD is harder to spot in girls. And for that reason, it often goes untreated and unmanaged. So boys more typically have a lot of the hyperactive, impulsive types of symptoms, and girls are more likely to be sort of inattentive and underachieving. So girls don't usually get the accommodations or treatments that they could use to succeed because their symptoms are less socially disruptive than boys often. Not always, you know, nothing is black and white, but that's generally the case. And so what tends to happen for girls is that their self-esteem is affected, their mental health is affected. Girls are more likely to internalize their frustrations, to blame themselves. And so girls with ADHD are actually higher risk for depression, anxiety, and eating disorders than girls without ADHD. And so a lot of girls have outgrown their ADHD skills, hyperactive or impulsive symptoms by adolescence, but they still have skill deficits in social functioning and academic functioning because of the things that they missed when they were younger, because of inattention, because of untreated ADHD. So there's this kind of lingering impact in girls that's directly related to the fact that it doesn't get diagnosed, it doesn't get treated, and girls with ADHD often miss some of those crucial developmental tasks, right? Figuring out how to stay organized, how to get homework done, how to, you know, interact, you know, interpersonally in different settings, all of these things when you're having inattention symptoms and you're not being treated or supported in any way around that, you know, you have a skill deficit. So So that's what happens in girls. And then, of course, girls grow up to be women. So ADHD in adults can look a little bit different than it looks in kids, but it's still sort of the same basic idea. So adults, women with ADHD often bounce from job to job. They may find it hard to finish daily tasks like getting chores done or paying bills, right? There's a lot of distraction. And remember, you know, most of us as adults are juggling a lot, right? Especially in this day and age, there's a lot that needs to be done, you know, and the sort of managerial skill that it takes to just sort of live life, it requires a lot from us and from our brains. So women with ADHD may forget the things that they need to do, get upset easily. So in the biz, we call that mood lability, but it's basically, you know, moods that are really reactive, performing unevenly at your job, having relationship problems, feeling stressed about not meeting responsibilities, feeling frustrated or guilty, overspending or having a hard time managing budget, having cluttered spaces. You often see this with ADHD, problems making decisions or difficulty with indecision, and difficulty listening. So as a result, of course, you know, whether you have ADHD or you don't, it's not hard to imagine that this causes a ton of distress, feelings of inadequacy, low self-esteem, chronic stress, and a constant feeling that life is out of control or in chaos. You know, and then I will sort of say one little thing, and I'll try not to get on too much of a soapbox throughout this, but I think, you know, societal expectations that women carry the mental load, generally speaking, again, you know, there are always exceptions, but generally speaking, women carry the mental load for caretaking, for children, for maybe elderly parents, for partners, for kind of managing life and a household. And, you know, those societal pressures and the sort of implicit expectation that women can manage this mental load, it can actually exacerbate the symptoms related to, you know, depression and mood symptoms that are related to ADHD in women with ADHD, because you know, there's sort of a double judgment, right? There's a double kind of self-blame and you know, distress that men simply don't experience in the same way, because there's not this expectation that men are like superheroes who do literally everything for everybody in their lives, right? And again, that's, I'll get off the soapbox, but I had to say it. And you know, if you're a woman, you know what I'm talking about. Okay, so hormones across the lifespan. So I want to talk a little bit about hormones, because of course we're here thinking about menopause, thinking about, you know, ADHD and the brain. And I want to just sort of give us a foundational, we're not going to spend a ton of time talking in depth about hormones, but a little bit of an idea about what's happening with our hormones or over the course of a lifetime. So sex hormones are, you know, you've probably heard about them in various contexts throughout your life. Sex hormones include estrogens, progesterone, and testosterone. So the main estrogen is called estradiol. And women, we actually do have low levels of testosterone. We hear about this mostly in men because they have much higher levels of testosterone, but we have some too. So estradiol and progesterone are typically considered the female sex hormones. And sex hormones are responsible for the expression of secondary sexual characteristics that happen during puberty. And so the secondary sexual characteristics, these are things like starting menstruation, breast development, pubic hair growth, all of that kind of stuff that happens during puberty. And estradiol and progesterone are known to have an effect on a lot of different aspects of health and behavior. So they're very important for a lot of different functions, not just reproduction or puberty. So at birth, hormone levels are actually very high in all infants because mom's hormone levels are very high during pregnancy. And this is just sort of a Ripley's Believe It or Not anecdote from my own life, but my youngest, actually both of my sons, when they were born for the first few weeks of their life, actually lactated. So this is not uncommon in babies, male or female babies, to lactate because they have so much of our pregnancy hormones from mom that can happen. So I did not know that beforehand. So fun fact for the evening. So after a few months, the hormone levels for babies, they level out, and they level out at very low levels and stay that way throughout childhood. So kids generally don't have high hormone levels, and if they do, there may be something wrong. So the average age of onset of puberty is now 10 and a half years old in girls, so it's getting younger. But it can range for anywhere from age 7 to about age 13 is kind of a normal range for puberty. And that's, first menstrual cycle typically occurring at 12 or 13 for most girls. And the entire process of puberty takes about 3 or 4 years. And during this time, there is a massive, what's called pruning of nerve cells in the brain. And that's actually triggered by a flood of hormones that happen during puberty. And pruning might sound like a bad thing, and we are getting rid of brain cells. We are pruning like you would prune, topiary or a tree or something. But actually what's happening during that time is that it's improving the efficiency of brain cells. So it's sort of tightening everything up, fine-tuning the connections between nerve cells so that the brain becomes much more efficient. And that's related to higher levels of estrogen and progesterone. That's part of that pruning process. So it's important to know for ADHD that hormonal changes that happen during puberty, especially these super high levels of estrogen and progesterone, can cause ADHD medications to be less effective. So if you know a young woman or a girl who's starting to go through puberty who is on an ADHD medication like Ritalin or Adderall, it's something to look out for, because these medications that might have worked for years all of a sudden may be less effective. Symptoms may be getting worse, and it might be kind of a mystery if you don't have a physician who's prescribing and is educated about the impact of hormones on ADHD and ADHD medications. So this is because progesterone can actually diminish the response to amphetamine types of medications. All right, so I've got pregnancy here. Obviously this is not a developmental stage necessarily. It's not like all women go through pregnancy. There are many women who do not, but since many women do, and hormones change a lot during pregnancy, I think it's worth mentioning. We can learn some things about the impact of hormones on brain functioning by looking at studies of pregnancy. So the results are a bit mixed. So pregnancy brain is real. If you've heard that term, it's kind of like brain fog, difficulty concentrating, problems with memory. And that is related to hormonal changes. So an increase in progesterone, if you remember, that also had a negative effect on ADHD medication effectiveness. Increased stress and chronic sleep disturbance. So there's a lot going on there. It's not just hormones. Pregnancy actually also shrinks the brain by 10%. The volume loss persists for about 2 years postpartum. So it takes about 2 years for the brain to expand back to its normal size. And sort of similar to adolescence, there is a theory that shrinkage during pregnancy improves the efficiency of certain brain processes. So specifically, that the shrinkage that happens actually increases the efficiency of social cognition. So social cognition is the ability to figure out what somebody else is thinking and feeling. I think that's absolutely fascinating, right? Because that seems to be like a pretty important skill for a mother, right? To help her potentially care for her baby, or to figure out what baby's cries mean and that sort of thing. But unfortunately, this seems to come at the cost of spatial memory. So this is what these studies show, which, you know, kind of makes sense because spatial memory, like being able to pack suitcases in a trunk, seems less vital to keeping a baby alive than social cognition, right? So really interesting studies out there on pregnancy and hormones and what happens to cognition during that time. And I think can give us some insight into ADHD. So other studies have shown that executive function in particular is a bit lower in pregnant women. So again, it shows that the hormones have a huge impact on cognition, you know, across multiple areas of function. And it seems like, you know, there's not a lot of research on this, honestly, but it seems like women with pre-existing ADHD are especially vulnerable to any of these kind of worsening effects of cognition during pregnancy, the brain fog, you know, worse executive function, worse spatial memory. So, you know, it's possible. There's some research that suggests that. There's also some research that shows that because pregnancy increases estrogen levels, which help your brain function and are better when you have ADHD, some women with ADHD actually report improved cognitive function during pregnancy. So the results are a bit mixed, but it's definitely interesting. Our hormones are really doing a number. So perimenopause is the period of life where a woman's body begins transitioning to menopause, so the end of monthly periods. That's all that menopause means. Perimenopause usually starts in the late 40s, although it can be much earlier or later, and it typically lasts several years. So during perimenopause, this is where you start to see some of these symptoms of lower estrogen. So periods become less regular. People have night sweats, difficulty sleeping, hot flashes, vaginal dryness, and mood issues. So those are all part of perimenopause. And, you know, sort of, I think, well understood to have a huge impact on functioning. So menopause typically occurs in the early 50s. And this is when there's that sharp, sharp drop. So this whole time during perimenopause, hormone levels are declining. And then in the early 50s, usually, sometimes earlier, sometimes later, there's this sharp drop in estrogen and progesterone, and the periods essentially stop. The ovaries stop releasing eggs into the fallopian tubes. And menopause technically, officially begins 12 months after the last period. And after that, the woman is considered in post-menopause. So the average age of menopause is 52. This means there are about 45 million postmenopausal women in the US alone. And most women are living at least a third of their lives in a postmenopausal state. So if you're somebody with ADHD, this particularly matters for you to understand that, right? That's a huge chunk of our lives, a third of our lives. And estrogen plays a huge role. So the loss of estrogen that happens just generally during menopause can cause bone mass loss. So women lose about an average of about 25% of their bone mass by age 60. Which 60 is young, you know, that's kind of wild. And, you know, it's why you see probably a lot of information out there about how important calcium is and a few other things, which we'll talk more about. And loss of estrogen also increases the risk of heart disease. So heart disease, I think, is still, I haven't checked recently, but the last I checked was is the #1 killer of women, actually. So lower estrogen levels also decreases your dopamine levels. So remember a couple of slides ago, we started talking about dopamine that has to do with, you know, pleasure, motivation, satisfaction, and it also controls motor and impulsivity function. So dopamine levels are already low in a brain with ADHD because those dopamine transporters are too darn efficient, and they're cleaning up the dopamine and getting rid of it and metabolizing it before it has a chance to fully have the effect that it's supposed to have on the brain. So the brain with ADHD is sort of chronically under dopamined, not having enough, and low levels of progesterone. So dropping estrogen decreases the dopamine level even further. And then low levels of progesterone also take a toll in addition. So low progesterone really is the driving force behind a lot of the psychological and mood factors that come with menopause. Low progesterone can cause irritability, rage, depression, anxiety, confusion, fatigue, memory lapses, difficulty concentrating, and decreased stress tolerance. So this is why it's important. This is why it's important to talk about menopause and ADHD, because it is a real change. It is a real challenge that impacts a huge number of women, right? So any woman with ADHD, diagnosed or not, over the age of about 60 or maybe 50 something, is at much higher risk for a lot of these cognitive problems, memory, concentration, in addition to the emotional piece, right? And so for women who have already dealt with a lot of cognitive symptoms and a lot of emotional symptoms, this can be an incredibly difficult time. And people who, 52 is young. This is not, somebody who's like, in the final years of their life, not working, not having responsibilities or something like that. 52, these are women who are working. They may be, very high functioning. They may have a ton of responsibilities at work, at home, in relationships. And, taking this huge hit in your hormone levels can be sort of shocking. It can be very confusing because this is not something that I've ever heard a physician talk to me about, and I haven't heard a lot of people talking about this. So, unless you happen to have a physician who's informed about ADHD and menopause, you're not going to hear this, right? You might hear something about menopause. You might hear from your psychiatrist or your psychologist about ADHD, but it can be sort of a mystery to people when this happens. Like, all of a sudden the last couple of years, it's like I used to have a system that worked for me when I was, getting my daily tasks done. And now I'm just all over the place. I can't remember. I'm dropping the ball on appointments that I've always been able to keep. Things can change, and it's very distressing. So let's talk specifically, we'll talk a little bit more about menopause and cognition. So, and here's a little, I guess I'll take a pause and let you guys read my little comic here. All right. Okay, so what's happening to hormone levels during menopause? So levels of all the sex hormones decline. So estrogens, including estradiol, have a protective effect on cognitive function. And as a sort of side note, this is often measured by verbal memory tests. For whatever reason, verbal memory seems to be very sensitive to fluctuations in hormones. So women do better on verbal memory tests when their estrogen levels are higher. So there are researchers who actually do this stuff. They ask women, where are you in your cycle? Are you pregnant? Are you in menopause? And can find that even over the course of a month, the same woman might have a different performance, a better or worse performance based on where she is in her cycle. So it's really, really a lot of control that these hormones have over us. Progesterone supports normal development of neurons in the brain. Testosterone, which, we don't have tons of it, but we do have it, and it does decline during menopause as well. Testosterone appears to impact attention, memory, and spatial ability as well. So, when these things decline, there's a lot of fallout in a lot of different areas of functioning. And both estrogens and progesterone seem to have an anti-inflammatory effect on the brain as well. Let's see, so we'll talk also executive function and menopause. So studies show that executive function declines in perimenopausal and early postmenopausal women, even without ADHD. So there is an age independent. So this means that even when age was not a factor, so if they sort of remove age as a variable, there's a decline in certain brain functions during menopause. So even if you're not that old, menopause causes certain brain functions to decline. So immediate and delayed verbal memory. So this is like your what people call short-term memory. That's kind of your immediate memory. And then your delayed recall, that's, let's say I tell you a list of words, and then 30 minutes later, I ask you to tell me the list of words. So that's what we consider a delay in psychological testing. Later on, after some distractions, what can you remember? So that declines. Organization declines. Working memory, which is our ability to kind of hold information and work with it. So, remembering a phone number as I just looked at it and now I'm going to dial it on my phone. That sort of thing, that's kind of a working memory task. Focus and attention. So these things decline even when you control for age, mood. So if you're depressed or not depressed, doesn't matter. You see declines across all these areas. Education. So doesn't matter if you're a PhD or a high school dropout. Race, and BMI. So they looked at a lot of different factors to figure out, is there something else that could explain this? These declines in all of these different domains that happen during menopause, and it's the hormones. Okay. So one other thing I want to say about executive function. So the effect on executive function of the decrease in hormone levels seems to be worse for women who experience an early or abrupt menopause. So 40 or younger is considered premature menopause. And the impact of the drop in hormones seems to be worse in terms of executive function for those women, which, probably just genetics and bad luck if that happens. So although this information is not specific to ADHD, we know that when you have baseline impairments in executive function, as in a brain with ADHD, you see an even greater impact on cognition and particularly executive function after menopause. I do have good news at the end of this. I just want to say that it's not all bad news. Okay. So mood, unfortunately, also is impacted by decreased progesterone. So depression, irritability, rage, we talked about. And we know from many, many years, huge body of research that mood impacts cognition. So, depression can actually mimic, can look like Alzheimer's disease. And when you treat the depression, the cognitive symptoms improve, it goes away. So, mood has a huge impact on cognitive function, which kind of makes sense, right? If you think about it, if you are depressed, you have low motivation, you may be sort of distracted, having, ruminating on things, being unable to concentrate. You may be sleeping a lot more or a lot less, right? All of these things are related to cognitive function. So, it's not a huge surprise, but mood has a big impact on cognition. So there can be kind of a snowball effect where a drop in hormone levels leads to low mood. And if that persists, that can become depression. Depression then has a negative impact on attention, motivation, memory, processing speed. But again, if adequately treated, these depression symptoms, the depression-related cognitive impact can improve, it can resolve. Oops, sorry. So I want to talk a little bit, I get this question a lot when I work with folks, when I do testing. People want to know this when I, do cognitive rehabilitation or, like brain training, memory type cog rehab with folks. They want to know, what is normal aging? What is dementia? And in this particular group, it's also important to ask, what is because of ADHD? My notes here. So normal aging, we expect during aging, over the course of somebody's lifetime, that there will be, well, I guess I'll back up even. So brains are not fully developed, frontal lobes in particular, not fully developed until about age 25. And then it's essentially all downhill from there. So if you're over 25 in this group, I have bad news for you, including myself. But, normal aging, we expect that there's going to be some mild decline. So people's brains get a little bit slower, processing speed gets a little bit slower, working memory, remember that ability to kind of hold and work with information at the same time. And fluency, so how fluidly and quickly and efficiently our brains work, those things do change a little. They get a little bit worse, not dramatically worse, right? So I think, we also live in a very ageist culture, and there is, sort of this expectation that, or this, I think portrayal in broader cultural, on social media and in commercials and in movies and TV shows that, older adults are all sort of demented, right? But that is not the case. So normal aging includes mild declines in some of these areas. What becomes concerning to me when I'm worried about mild cognitive impairment or dementia, I'm looking at, okay, is this person having declines in one or more areas of function that are so impaired that it's getting in the way of their ability to do daily tasks that they could normally do, right? So is it causing this person not to be able to keep track of their finances, not to be able to keep track of their meds, to miss medical appointments that they would have easily managed in the past, to not be able to operate a computer when they used to be able to do that kind of stuff, right? And, I think, so these things are the kind of things that most physicians are thinking about if they're working with an older adult. It's, I think, a lot less likely for a doctor to consider, could this be related to ADHD? Could what we're seeing here be related to ADHD? Because a lot of doctors think of this as a childhood disorder. You probably know that, if you've had any experience with doctors as an adult with ADHD. So some things that can help, probably the biggest thing that's going to help your doctor or your psychologist or your psychiatrist point in the right direction, or kind of distinguish what is normal aging versus what is concerning for possible dementia versus what is ADHD. Because a lot of times, I don't know about a lot of times, but sometimes people with ADHD who are aging can get misdiagnosed with dementia. Or some other neurodegenerative process. So the biggest clue is going to be your personal history. So in order for ADHD to be diagnosed, the symptoms have to be present during childhood as part, as that's part of the diagnosis, is that they started when you were a kid. Doesn't mean you have to be diagnosed when you're a kid, but it means you have to have some of these symptoms from a very early age. You have to have, most times I talk to folks and they're like, oh yeah, I was always the kid that was getting in trouble for talking out of turn, or getting up out of my seat, or not sitting still, or not paying attention, right? And you hear that often from older adults who have ADHD that they've never had a diagnosis for. And the other thing that's going to be really important in kind of teasing apart these things that can be hard to tease apart is going to be your family history, because ADHD is so genetically loaded. It very commonly runs in families. So it can be hard for doctors to diagnose ADHD when you're an older adult because the symptoms might be similar to other conditions. But ADHD dates back to your childhood. And the other thing is that ADHD can improve with certain treatments, whereas most of the things that cause dementia, like Alzheimer's disease, vascular dementia, Parkinson's disease, are not reversible. So if you suspect the ADHD, or if your physician suspects it, it can help to try an ADHD medication, see if it helps. Because if you have dementia, or the beginnings of dementia, ADHD medication is not going to help. If you have ADHD, it will, for most people. So we'll sort of transition from the sort of background and understanding ADHD and menopause, and now let's talk about the practical stuff. So how do we manage ADHD and aging? So here's the bad news first. There is no magic pill. The bottom line, and Suzanne alluded to this too in the beginning, that, the reality is treating ADHD is not, it's not a pill. It's not, a 16-week course of psychotherapy and then you're cured. It's a lifelong, holistic approach to treatment that is going to be the most effective for people. So, unfortunately, ADHD around and after menopause will likely require a higher level of management and energy directed toward it than prior to menopause. It's very frustrating, but the good news is that there are a lot of different ways that you can support your brain health and function, even with the added burden of menopause and ADHD. So the first, and this is true whether you have ADHD or not, the best thing you can possibly do to preserve your brain health over the course of your life is exercise. So physical activity increases brain neurotransmitters like dopamine and others, which can affect attention. And sorry, hang on. I did some of my training up at UCSF, the Memory and Aging Clinic there, which is, one of the best in the world. And so, I was a postdoctoral fellow working with these like rock star neurologists up there. And the thing that they told every single patient that we saw, so this is your like free rock star neurologist piece of advice, is that if it's good for your heart, it's good for your brain. And exercise is the best thing you can do for your heart. So this means weight bearing and cardio, something that gets your heart pumping. So walking is actually a great one. You don't have to do some kind of like extreme, like hit high intensity interval, boot camp, whatever. Walking is great, or riding a bike, or hiking. You don't have to do anything wild to get good exercise. So, I think they say 30 minutes at least 5 times a week. Do your best. Okay, so nutrition. This is the other piece where really, if it's good for your heart, it's going to be good for your brain function. So I always recommend to my patients a Mediterranean diet. So it's heavy in vegetables, fruits, lean proteins, healthy fats like olive oil. You get whole grains, and I guess the other thing I'll say about that is everything in moderation, right? So I would never encourage adhering to a super strict diet where you never you don't eat birthday cake at a birthday party, or you don't have a glass of champagne on New Year's Eve if you want one, or whatever it is, right? I would never advocate for that. So to be clear, heart healthy diet, the best you can, and never to the point that you are not also being present in and enjoying your life. And then calcium and vitamin D. So because bone loss is such a big deal, it's really important to make sure that you get calcium and vitamin D together. So you can take a supplement, you can, eat certain things in your diet to kind of increase those levels. And then sleep. So sleep, I think, is often underestimated as a contributing factor to cognitive problems. But there's a ton of research out there that shows us that sleep is crucial. And so I think people will say, well, yeah, I'm only sleeping 4 or 5 hours a night, but, what pill can I take, to make my cognition better? It's like, well, yeah, there's probably a pill you can take, and you got to get better sleep than that. You're chronically sleep deprived, and that your brain cannot do what it needs to do. And executive function is the first thing to go when we don't have sleep, as you probably know if you have ever been sleep deprived. So good sleep hygiene. This means setting up a bedtime routine, avoiding caffeine after noon, avoiding electronic devices within an hour of bedtime, trying to go to sleep and wake up at the same set times every day. All of these things can help. And if I'm not going to delve too deeply into sleep hygiene, but there's a ton of information on the internet. There are a ton of super great handouts that you can, if you type in sleep hygiene into Google, you'll find lots and lots of resources. It's not rocket science, but it is behavior change for most people, because we're not very good about this, right? Most people are sitting in their bed, staring at their phone or their iPad until they shut it down and then try to go to sleep, but their mind is still, on the hamster wheel. So setting yourself up for good sleep is really important. And then vices. So let's talk about vices. I highly recommend, again, good for your heart, good for your brain. If you are a smoker, you got to quit smoking. It's not good for your health, obviously, for many reasons. But smoking is actually one way that your brain can sort of get deprived of oxygen, because your heart has to work harder. And so when your heart is working really hard, your brain, which needs blood to deliver oxygen, is not getting enough oxygen. And so tiny bits of tissue die. So smoking itself, all by itself, doesn't probably cause that, but smoking does increase your vascular risk a lot. And increased vascular risk is, it's an increased risk for vascular dementia and for that, that microscopic tissue death that can happen when your brain doesn't get enough oxygen. So quit smoking. Psychologists can help with that too. There are a lot of great smoking cessation programs out there. There are a lot of ways that behavioral health can be very effective and help you. You don't just have to take a pill or do a patch or go cold turkey. Limiting alcohol to 1 per day or no more than 7 a week. And you shouldn't have all 7 in one day. The last time I gave this talk, somebody asked that. Don't do it. Again, I would never advocate, I don't think anybody here needs to live like a monk, although they're probably healthy and going to outlive everybody, but, you don't have to deprive yourself of the things that bring you joy. And the reality is that ADHD symptoms are going to respond to these lifestyle changes. They really will. And it might be that you never had to do this stuff before to kind of basically have your ADHD manageable. And then when menopause hits, you have to do more than you did before. So it sucks, but it's reality. And then I want to talk about cognitive strategies too. So these are things, and I'm happy to send the slides to you guys if it would be helpful to have this. I don't expect you to remember this all. So maybe Suzanne can help me with that at the end. So there are also non-medication options for managing ADHD. So cognitive strategies, I'm going to talk about just a handful of my favorites that I work on with folks when I do cog rehab. And cognitive rehab is basically just a brief, usually pretty brief course of therapy where we're really focusing on skill building and problem solving. So it's not like, psychoanalysis or something where we're trying to treat depression. It's really about practical skill building. So write it down. I encourage everybody to keep a note to self book, either in your phone. You can do, notes on your phone. Everybody's got a notes app, or keep a small notebook in your pocket or your purse. Write down things when you think of them. If you think of a to-do, things you want to follow up on, somebody's name that you meet and where you met them, who they are. It's so helpful because it lets your brain have a break, right? You don't have to remember stuff if you know it's written down in your notebook. So this is a habit that it takes a while to build, but it's so worth it. And you might have to enlist the help of somebody else. Maybe your partner or your kid has to remind you, hey, did you check your notebook? What do you have in your notebook from today, right? You might have to, before you build the habit, you might have to have a little bit of help, but it's well worth it. Using calendars and alarms, you have these things in your phone, use them to your advantage. Set alerts and reminders for what you need to do, your daily tasks, maybe taking a medication, time to leave now to go pick so-and-so up from the airport, whatever it is for you. Take advantage of technology. Timer for tasks. So if you have a hard time following through on tasks, I recommend you set a timer for yourself for a realistic amount of time that you'll spend to work on something without distractions. So I wouldn't recommend setting it for an hour. A non-ADHD brain has a hard time with that, but maybe 15 minutes. And you know what? You can hit it hard for 15 minutes and then take a break and let your mind wander or check Instagram or whatever it is. And then set it for another 15 minutes when you're ready and come back to it. Hit it hard, no distractions, 15 minutes, and then you get a break, right? So that can be really helpful to help you get through something that you don't want to do or that's hard to focus on. Lists. So I think it can be very helpful to take the time to think through tasks and break them down into smaller tasks. If you're packing for a trip, write down everything that you're going to need and follow the list. Check it off when you put it in the suitcase, or a checklist for your evening routine if it's hard to stick by that. Electronics off at 9 p.m. Choose an outfit for tomorrow. Set up coffee for auto brew. Do your skincare routine. Brush your teeth. Pajamas. Evening meds at X time. Cup of chamomile tea. Mindfulness exercise. Lights out. That's sort of, that's our perfect psychologist evening that all of us are very good at, right? Or it could be a checklist of to-dos for a busy day at work. This is honestly, I have a job where I am pulled in about 500 different directions. And this is how I manage it. I literally have a list. Everything is on my calendar. Everything is listed. If it's not on there, it's not going to happen. I don't rely on my brain that way because I won't do it. 9 a.m. call ABC person. 10, meeting with so-and-so. 10:30, check email. 12 p.m., lunch and walk. 1 p.m., work on report, etc. So the more you make lists and get those to-dos out of your brain and on paper, the less work your brain has to do to try to keep things organized and remember. Be in a routine. So this is the best possible thing. For everyday tasks, it really helps to have a routine that doesn't change. So you develop muscle memory. So you don't have to tax your brain remembering things. Your body knows, your brain knows it's a routine. It's the same every day. That helps. It helps take the pressure off. Can't miss it. So I like this because you set yourself up for success by making it impossible to miss things that you need to remember. So my example is that I always hang my reusable grocery bags on the doorknob, like the night before, if I know I'm going to go shopping the next day, so that I literally cannot miss them, right? I cannot walk out of my door without those bags unless I'm really trying. Put things where you can't miss them. Say no. This is one of my favorites as well. No is a complete sentence. Take the time to prioritize your life, prioritize your activities. If you're somebody who's feeling constantly overwhelmed, constantly stressed, it is absolutely affecting your mental health and probably your physical health too. Be brutally honest with yourself. Make a list of all the stuff you do, and then be even more brutally honest about what you do have to do and what you don't have to do. So you have to consider what is absolutely necessary. Can I get, I have to go to my job, I have to care for my child, what's not necessary, but you enjoy it. I want to watch TV, I want to fool around on social media, I want to go out, and do fun things. What is not necessary, and perhaps you don't enjoy it. Serving on the HOA, being part of a committee at work that needed somebody and you felt pressured into doing it. So think about these things and then figure out how to prioritize them. Say no to things. Again, I think societally, we often feel pressure to say yes to everything. We do not have to do that. We can struggle with guilt when we say no, but it's really important. It is self-care to set boundaries. So, you don't owe anyone an explanation. No is a complete sentence. And sometimes self-care is setting that boundary and saying no. So I will say that. And then ask for help. Are there aspects of the necessary elements that you have to do in life that you can outsource, or that you can rely on somebody for help with? Can you get a babysitter or leave family or kids with family for an afternoon every once in a while to have some time for yourself? Can you hire somebody to clean your house sometimes? Can you ask for help, caring for an elderly parent? Can you meal plan and prep ahead of time, or maybe trade off with a partner or a teenage kid for cooking dinner? If you have a hard time remembering to do things, can you ask your partner or somebody else to remind you, like setting a human alarm? So there are a lot of cognitive strategies out there. This is not a comprehensive list. Again, these are some of my favorites that I teach people and work on in Cog Rehab when I work with folks who need help with executive function. And they can be incredibly effective. It's like not sexy to say, oh, like write things down and set alarms in your phone and say no and set boundaries. That's like not fun. People want like, ooh, what's it, like a cool pill that I can take that will just fix all of this? There's no pill. But these things, they work. They might not be exciting, but they work. And then finally, the other piece of managing ADHD, in my opinion, is getting support. So this could be individual psychotherapy. It could be group psychotherapy. So I have done in the past a group called CogSmart, which is basically teaching all of these like brain health strategies, memory strategies for folks, and that is in a group setting, and it's really fun, and people get a lot out of it. Practicing mindfulness. So if you are not practicing mindfulness, you should be. And you can go to a therapist for that, or you can, there's so many mindfulness resources out there right now. I'll tell you a couple of my favorite apps in a second, but you can get an app that will help you learn how to do mindfulness, and it helps you to be present. Be present right now in this moment without beating yourself up, without worrying about what's coming next, without thinking about, ruminating on the past, but just be present. And I think that, all of us could use some help with that. And then, of course, medications. So, you might think about ADHD medications, and I think there can often be a misnomer among psychiatrists who don't have a geriatric specialty that it's not safe for older adults to take stimulant medications. It really depends on your personal history. So you can talk to your provider about it. There are often benefits of those medications in older women. And sometimes they are unsafe because you have other conditions, heart conditions, things like that. But a lot of times they are safe. So if you have a doctor who's telling you no because of your age, that's not the whole story. And I would look for somebody else who might know a bit more. A geropsychiatrist, honestly, is what I would be looking for. And then, of course, I recommend talking to your gynecologist about this as well, right? Because they have the menopause knowledge. And if you're really feeling salty, you might have your psychiatrist and your gynecologist talk to each other, because your hormones and your ADHD are interacting with each other. And, there are some risks. I'm not a prescriber, so I can't answer probably a lot of the detailed questions about this, but, there are some risks of hormone therapy, hormone replacement therapy, heart disease, strokes, blood clots, certain kinds of cancer. But these risks seem to vary depending on a few things: the type of hormone therapy. So estrogen alone seems possibly a bit safer for most people. Depends on your health history. And it depends on your age. So women who begin hormone therapy at 60 or older, or more than 10 years from the onset of menopause, are at greater risk for these things, for stroke and heart disease and cancer. But if you start hormone replacement therapy younger, before the age of 60, or within 10 years of menopause, the benefits generally tend to outweigh the risks. So again, this is a very personal thing. Pros and cons, it's important to talk to your doctor, and maybe both of your doctors. Okay, so this is just a list of recommended media, books, and things that I like. Again, I'm happy to send the slides out to the group so you don't have to like frantically write this down. And my favorite ADHD book is Taking Charge of Adult ADHD by Russell Barkley. He breaks it down about executive function and gives very practical strategies. And he is sort of the OG ADHD guy. He's really it. So love that book. If you're somebody where ADHD is affecting your relationship, this book by Melissa Orlov is a good one. The Mindfulness Prescription for Adult ADHD is also a lovely book if you're really interested in mindfulness. It can be really useful. And then I like this one by Gail Saltz because it's sort of a positive focus, right? It's looking at, what are the positives of ADHD? What are the ways that you can focus on your strengths? And that's kind of a nice different perspective. And then Calm and Headspace are both mindfulness apps. There are tons of them out there. And then there are several podcasts that either I've listened to and liked or I've had recommended to me by patients. Okay, so now it's time for questions. So maybe I will, and here's my information. So, I practice in Redondo Beach and mostly telehealth right now, of course. I have a website, I have a phone number. There it is. Okay, so let me stop sharing and maybe we can have some time for questions. I see there's like the chat's blown up, so.
Fantastic. That was so great. Thank you so much.
You're welcome.
So much information. I am going to be ironic and start us off with a question about boys.
Okay. Yeah.
We're talking about women. So one of the questions where you had mentioned that ADHD medication can lose its effectiveness like during puberty because of hormones and things. So is that true for boys as well? Like that when their hormones are changing, that it also affects them as well?
So no, it is specific to girls because progesterone and estrogen have such a profound impact on cognitive function, and boys don't have giant spikes and like progesterone and estrogen going all over the place. So no, it is only an effect that's seen in girls.
Oh, another lucky thing we ladies have. Let's see. And you covered, somebody had a question about doctors suggesting not treating older women that have ADHD with medication. And so your recommendation is finding a geropsychiatrist.
So yeah, so if you can, there are so I'm a geropsychologist, there are geropsychiatrists. It just means somebody who has some additional specialty training in working with older adults. So, because older adults are a different population with different needs, their physiology is different, so if you can find a geropsychiatrist, somebody who, they may not call themselves that, but if you can find a psychiatrist who has some specialty in working with older adults, or who commonly works with older adults, that's like the sweet spot. they're unicorns, honestly. You know, it's hard to find them. But you know, it's worth continuing to ask, you know, ask every doctor you interact with, do you know a psychiatrist who specializes or has some special knowledge about working with older adults? You know, it never hurts to ask. Somebody knows somebody somewhere.
Right. Okay. That's great. Thank you. And then also the question of hormone replacement therapy and how it can affect cognition and ADHD, both in menopause and perimenopause.
Yeah.
Can that be kind of a combination treatment with ADHD medication?
Yes. Yeah, absolutely. So it can improve cognitive function. So it's, you know, it's probably not going to like make everything just like it was before. That, you know, just doesn't happen. But yes, increasing levels of estrogen in particular can have a positive impact on cognitive function. But again, you know, there is going to be some additional management that has to happen because menopause and ADHD just are sort of a double whammy cognitively. So you're probably going to have to do some things behaviorally differently than you did before. But yeah, the hormone replacement therapy can help.
Sure. And in that regard, when you are using that, do you recommend that you said if you could have your gynecologist talk to your psychiatrist, talk to your general practitioner, like you should have them all kind of talking and kind of coordinating your care?
That's sort of like the best case scenario. So, you know, it can be easier if you're in a system, like if you're in Kaiser or you go to a system like the VA, or all of your care is at UCLA Health or something, where like those physicians in those practices, they have a release to talk to each other. Like they work within the same system, right? So if you go to, you know, people in private practices or smaller clinics that aren't part of a big system, they can still talk to each other. All you have to do is sign a release of information giving them permission, because you know there are privacy laws, so that we can't talk to each other without asking you first. But if you give them written permission and you say, I want you to talk to my gynecologist because I think menopause is impacting and worsening my ADHD symptoms that you're treating, psychiatrist, you know, would you talk to them? I would imagine that, you know, most physicians would be open to that. You know, and it might be a little bit unusual, but change has to start somewhere, right? I mean, there's tons of research out there. We know there's a connection. And so if we can have people, you know, get their teams talking to each other, it's going to be better care.
Absolutely. And I think that's one of the things that as we get older with ADHD can be so challenging, because coordinating medical care is one of the hardest things for people as they get older, whether they have ADHD or not. And so that's a good tip. If you can get everybody in the same like healthcare system, that can often be a really good way to easily get them being able to share your information.
Yeah, I mean, that's, you know, that's definitely the most straightforward way if that's available to you.
Yeah.
You know.
Okay. Thank you. Let's see. There was another question. If early menopause negatively affects women, what happens if it's delayed? Do you get a reprieve or?
Yeah, that's a good question. I honestly don't know the answer, but my guess is yeah, because the biggest factor that's causing all of these cognitive impacts is that sharp decrease in the hormone level. So if that's sort of postponed, you probably do, you know, you probably do get a little bit of a reprieve temporarily. None of us escape it, but
none of us escape it.
You might get a little bit of a break. Yeah.
That's great. The last question I have, and then we'll just check to make sure that there are no more, is that somebody was wondering, how can we find out more about CogSmart and possibly get involved in that program?
Yeah, so CogSmart is, you know, for me in my practice, I just run that group periodically. So I'll just kind of, you know, post about it on like the LA County Psych Association listserv, or kind of word of mouth, let my referral network know, like, hey, I'm starting a CogSmart group if you know anybody who might be interested. So if you're interested in doing that with me, you can just like shoot me an email or give me a call and let me know that. And I usually kind of wait till I have, you know, a quorum of group members who are interested and committed, and then we kind of go forward with it. And it's usually like a 12-week group. It could be a few more sessions or a few less sessions. That's how I do it. But CogSmart is an evidence-based practice that was actually developed at the San Diego VA. And so there are people, you know, it's kind of like cognitive behavioral therapy or dialectic behavioral therapy. If you've heard of like these certain types of evidence-based practice, this is one of them. It's not super well known, you know, like CBT, but there are a lot of people who do this. So it's not like something I made up and I'm the only one who does it or something. You know, I'm not exactly sure. I have never looked online, I'll be honest, to see like who's doing this and how do I find a group. You know, I don't know that it's like widely practiced enough that there's an online registry or something like that. But you know, I am 100% sure that I'm not the only person locally who is doing it, but I don't really know how to connect you to that resource.
Okay. Okay. Well, if you can keep us, keep us posted if you're going to do it, and we can definitely share that. Somebody asked, do you have any idea about how much the program costs to be a part of?
With CogSmart?
Yes.
Well, it probably varies depending on who you go with. So, so I can speak about myself. So I take Medicare and private pay only. So I don't take other insurances, but I do take Medicare. You know, and for folks who don't have Medicare, typically I'll give a super bill, which is something that you can submit to your own insurance. You may be familiar with this. And then they'll reimburse you some portion of the cost. So they don't usually reimburse the whole cost, but they can. I mean, I think, you know, CogSmart group therapy is generally a lot more affordable than individual psychotherapy if you're worried about the cost. And it's also, you know, at least in the case of CogSmart, it's a time limited group. So you know that like you can budget for it, right? It's not like this endless, you know, forever commitment of, you know, $250 a week or something like that, you know, how it might be in private pay for therapy. So it might be more affordable than you think. And it really kind of depends on your insurance, who you see, you know, that kind of stuff. So it's hard to say exactly, but you know, I don't think it's a set cost. It's going to depend based on provider.
Okay. All right. Great. So that was all the questions that were submitted. Does anybody else want to raise their hand with a question, or did I get them all? I think that might be everybody. Awesome. Thank you so much for being here. I can't tell you how much I appreciate it. This is so helpful. I mean, that's very helpful to me personally. I'm entering the zone, so I definitely appreciate it. And I know all of the ladies that were here with us tonight appreciate it too. I want to thank everybody else for being here as well, and just remind you that we do have our adult support group every Sunday night. We have a support group for teen women on Sunday afternoons, and then we have our parent support group the first Friday of every month. So I hope that you'll visit us again. And if you got anything out of this meeting tonight and you'd be so kind as to leave us a donation, that would be greatly appreciated. And thank you so much, Dr. Reger, for donating your time tonight. We greatly appreciate you.
Yeah, thank you all so much for having me, and thank you for your excellent questions. And don't hesitate to reach out if I can be helpful.
Thank you so much. Take care. Have a good evening, everyone. Bye-bye.